thousands of NHS staff in England who face losing their jobs at the start of April when laws on mandatory jabs for health workers come into force.
Well, it's estimated that there are more than 100,000 NHS staff who are currently unvaccinated, making up as many as 1 in 5 employees in some trusts.
Well, amongst them is Dr Goodman, who, despite the new regulations, is standing by her refusal of the vaccine.
And she's joining us now alongside Dr Philippa. Good morning to both of you. Thank you for being here today. So, Kate, if you don't mind, let's start with you first of all. Now, before the new regulations were put in place, what were your thoughts on the vaccine back then?
Sorry. Good morning, guys. Good morning. Thank you so much for having me on. I think that the vaccine has been wonderful. I'm an elderly care specialist, so most of my patients are incredibly vulnerable to COVID. So I've recommended to all of them that they get the vaccine. I think it has been fantastic in reducing their risks of hospitalisation and death, and I think that's wonderful. I'm in my 30s. I'm fit and healthy. I am not at risk from COVID. I'm not vulnerable the way that my patients are. So that's why I chose not to have the vaccine. That doesn't mean that I don't think it's a wonderful thing.
So, you're, as you say, you're a speciality doctor, elderly care, worked for the NHS for 9 years.
Yep.
If you are, and we saw so many elderly people lose their lives in the first wave, and obviously there were major mistakes that were made there. Wouldn't you consider doing this just in case, for the sake of protecting those people? Because you can still pass it on.
You can still pass it on when you've been vaccinated.
Less so.
Well, yes and no. So, I mean, there's plenty of studies now that show that that the virus it gets around the vaccine, even with Delta, and there's more evidence coming to light now with Omicron that the virus is even better at getting around the vaccine now than it was. I mean, you can see that just in real world. Like I know plenty of colleagues who are now isolating with COVID, even though they've had 2 or 3 vaccines. This doesn't prevent you from getting COVID, and when you have COVID, you still have the same viral load, whether you're vaccinated or unvaccinated. So you are...
While you're saying this, I think it's good to add balance from the other side as well, because Dr Philippa, actually, that same viral load is something that we've been saying differently here, because we've heard different reports. So can you just say from your side?
First of all, yes, it's possible to cherry-pick particular parts of the data, but we have to remember that the vaccine, and in particular the booster, we're not just talking about antibodies, we're talking about another part of the immune system called the T-cell immunity, and we know that the booster really makes a difference with that. You are not guaranteed with anything, but you are less likely to get it. That's the first thing. Significantly less likely to get it, and therefore automatically less likely to pass it on. If you do have it, your viral load is lower, but you're also more likely to clear that much quicker, which means that you are infectious for a shorter period of time. So again, you are less likely to pass it on.
Everyone has a right to choose what they want to do. You have a right to choose what you want to do. I mean, there'll be people who would be surprised that you were in elderly care and that you chosen to do that. There'll be others that wouldn't be. Having said that, this legislation comes in April. As I said before, you have 9 years of experience. That's 9 years of your expertise that essentially could go to waste. How do you feel about losing your job because of this?
Obviously terrible. Like, I don't want to lose my career. It's not just 9 years, it's an entire lifetime. I've been working towards this since I was 5. However, I think it's incredibly important to stand up for the fundamental principle of bodily autonomy.
Have you had other vaccines?
Yes, I have. So I'm not saying that I'm anti-vax. I just have weighed up the risks and benefits of this particular vaccine for myself, and I don't feel that the benefits outweigh the risks for me personally. And I think that everyone should be given the choice. It's a core part of medical ethics, and I don't understand why not more people aren't standing up.
You aren't on your own, because there is someone else who is standing up to this. We're joined now by midwife Erika Thompson, who, just like Kate, faces losing her job in April. And Erika, when you heard these new regulations were coming into force, how did you feel? Because, again, this is a job that you love. This is a job that you're very good at. This is a job that you've been doing for an incredibly long time. How did you feel?
Oh, devastated, absolutely devastated. I spend my whole career working with women and families, balancing up choice and risks, benefits of decisions they're making, and then to be told that I can't do that for myself, I just devastated.
So what's your reason?
For not taking the vaccine?
Yeah.
Well, I do have reasons for doing that, but I think today what we want to talk about is the fact that we're losing the ability to choose, that we are being mandated and told that we don't have a choice, regardless of
I absolutely appreciate that, but I think there could be mums who've got new babies, who, and you know, every mum is incredibly careful about their health, their baby's health. They may, if they see your face and think, oh, God, she's unvaccinated, they have a right to know why you chose not to do that, surely.
OK, well, I will tell you my reasons, but they are my reasons. Somebody else may have the same circumstances as me and choose that the balance of risk means that they do want to have the vaccine, and I would support them to do that. But my reasons are, I've had myocarditis in the past, I've had pericarditis in the past, I've also had a neurological functional disorder in the past, and I've also had my mother die of Guillain-Barré syndrome, which all of those things have been, very rarely, I have to say, but linked with the vaccine.
So me... just to pick up on that, and thank you for being so honest with that, and we appreciate that. But so you are one of those people who's chosen not to have the vaccine, but you do have underlying health issues.
Sorry, you cut out then. I didn't quite hear the question.
You say that you have had heart issues, you've had myocarditis, you've had pericarditis, so you're choosing not to have the vaccine, but you do have underlying health issues. So aren't you putting yourself at risk even more?
I've looked at the risks of COVID. I have had COVID. I've now got antibodies. I looked at the risks of COVID. I looked at the risks of the vaccine. And then for me personally, I balanced those risks and felt that the risk of the vaccine, given the fact that we are seeing more myocarditis, was too great for me. I've got 4 children. I need to stay healthy. I've got my women and families that I care for. I need to stay healthy. And I also have balanced up the risk. Am I putting my patients at risk? And I looked at that very carefully. You know, I've worked for 21 years. I often put the needs of my families before my own. I'm not going to start putting them at risk now. So I looked at it, am I putting them at risk? There's a very good study published in The Lancet which shows that the reduction of transmission is the same in vaccinated and unvaccinated people, that we carry it in the nasal cavity in an equal viral load. And
okay, well,
I'm confident that if I was ill, I wouldn't be going to work.
We are, I mean, there is a, Dr Philippa, there's sort of 2 sides to this, really, isn't there? There's a, as you would say, there is a moral duty to get vaccinated to protect your patients. Yeah. But then you do have a moral duty to yourself to do the right thing for you. So
absolutely.
This is very hard.
Everybody has the right to autonomy, that you get to decide what happens to your body. That is absolutely true. However, do you have the right to decide what might happen to my body and potentially put me at risk? Now, just for people listening about myocarditis, the risks of getting myocarditis are greater with COVID itself than with the vaccine. I do believe that we as doctors, and it is part of the GMC guidance for doctors, that we should do everything that we can to protect our patients from a risk of harm from ourselves, and that would include vaccination. Yes, we have freedom of choice, but there may be consequences to those choices, and that's what we're talking about now. And at the moment, it seems that the consequence will be that people's jobs are on the line. Now, that bit is and it leads to an issue of shortages within the NHS and whether or not people should be moved out of the front line into non-patient-facing roles and a whole other range of issues.
The NHS has 93,000 vacancies. They need 40,000 nurses. Dozens of NHS trusts have declared major incidents. The last thing we should be doing is losing people here, like Erika, a midwife for 21 years, like Kate, who's working with in elderly care. These people who are so vital to keeping the NHS running, yet we're sacking them in April.
And it is an incredibly difficult issue, and that's why I would strongly encourage any one of my colleagues out there to go and get the vaccine.
So let me just say, Erika, just finally, well, how do you feel about losing your job?
Devastated again. I think that it's absolutely ludicrous that we are firing people that have run the service from the very beginning of the pandemic. We've all attended. I left maternity leave early to help the healthcare system and provide care. At that point, we had no idea what the virus was about. We had no PPE. We just mucked in and we looked after people as best that we could. And to reward those people now by saying, we actually are going to go against your principles and ask you to choose between your health, your principles and your job is absolutely ludicrous. It's against our code. It's against the law. You cannot coerce and force somebody into a medical treatment. It's I would never do it as a practitioner, and I don't understand why the government feel it's OK to do it now.
All right, thank you both. Thank you. It's against the code, Philippa.
No one's forcing them to have it. There's just a consequence of the choice
of
not having it. But the right to bodily autonomy still holds true.
Thank you. Thank you. Well, we're speaking to Jonathan Ball now, who's a Professor of Molecular Virology from the University of Nottingham. And you've just been listening to the conversation that we're having then. You were obviously the expert in this, so we wanted to come to you. There's concerns being raised of the level of long-term data on these vaccines. That's what the ladies there were questioning. Extensive tests have been done. Would you just like to clarify some of that for us?
Yeah, well, I think it's fair to say that the whole point of long-term testing is that you need to administer that vaccine to a population for very long periods, and we simply haven't had that. The pandemic started 2 years ago, and we've had vaccines for around a year. What we have got, though, is masses of data from literally millions of people who have received a variety of vaccines, including the vaccines that are being rolled out and mainly used here in the United Kingdom. And the safety profile for those vaccines is incredibly good. We know of the side effects, and most of the side effects are unpleasant. They can make you feel uncomfortable. It can range from no side effects to maybe soreness at the injection site, feeling a bit rough as though you've got a viral infection, to some of the more very rare side effects, particularly the myocarditis, pericarditis. So we are aware of those problems, but similarly, we are aware of the problems that SARS infection causes to the general population and also to vulnerable people. And therefore, on the balance of the risks and benefits, that's why we're in the position where we are strongly encouraging everybody to get vaccinated, and for people who are in key jobs, particularly facing patients, especially vulnerable patients, that there is a discussion, a debate to be had about how the best way forward is in protecting those.
There's a lot of people say, well, it's experimental, it's been rushed. So let's answer that one. And the fact that Kate actually said the virus gets around the vaccine. Those were her words.
OK, so I'll take the second one first, if I may, because I think, in terms of the vaccines are being rushed. As I say, it's been contracted into a fairly tight timescale, but the number of people who have received the vaccines is immense, far greater than any clinical trial we'd ever had in the past. And so we are well aware of that safety data. In terms of the virus getting around the vaccines, yes, it's true. So what we've seen, particularly with the emergence of the Omicron virus, or the variant, is the fact that it is particularly adept at dodging the particularly antibody response, and so that it can infect people who have been vaccinated. But what we do know as well from the studies, particularly in Israel, who've always led the way in terms of rolling out boosters and things like that, so they've been very proactive in their battle against the virus. What we do know is that booster reinstates that protection from infection. Now, it's true that the protection from infection will wane over time, and we don't know exactly when it will, how long it takes for the virus to be able to get around that immunity. But certainly in the short term, at a period when we have huge numbers of transmissions in the community, when risk of getting infection introduced into the hospital setting is at its highest, we know that an additional vaccine dose will reduce your chances of getting infected and therefore passing on the virus.
These two highly qualified women we're very thankful that they've come on today to discuss this, could lose their jobs in April. We've been told that Omicron, it appears to be the start of the tail off. It is less dangerous if you catch it. There is less chance that it's going to put you in hospital, vaccinated or not, because it is a milder illness, we are led to believe. So therefore, is it fair that these two women and the people that they represent within the NHS and the healthcare services should lose their jobs to a virus that appears to be starting to tail off in April?
Okay, so if we take the first bit about is this virus less dangerous, there are two elements that make up how dangerous a virus is. One is the properties of the virus itself, how likely it is to cause disease in a population that's never seen the virus or never been vaccinated. And we think that it might be slightly less dangerous. But if you do get infected and you've not been vaccinated with this virus, there is still a very high chance that you'll be seriously ill, particularly if you're vulnerable, and that you'll end up in hospital, potentially on a ventilator, and also possibly die. So it is still a serious foe. But what we have got is large levels of population immunity, which makes it appear less dangerous. And so I think, we don't need to overinterpret the diminishing threat from the Omicron virus, for example. But I do think that they've raised some very important points. And I do think that it's time for Department of Health or the NHS to have some serious thoughts. And I'm not saying that they haven't had to date. I think, we were at a peak of virus transmission that we've never seen before throughout this pandemic. So we had to do something. But I think we do need to start having an active dialogue about how we continue to protect people who are most vulnerable, particularly in a hospital setting or the health.
Just finally, I'm sorry to interrupt you, Professor, okay. But just finally, very quickly, should they lose their jobs? Is there any need for that now? This was a decision that was made before we got to the point where we are now. Should they lose their jobs?
I think we need to look at how best to protect vulnerable populations in hospitals, and whether that's through enforced vaccination or if it's through other measures, such as regular testing of people who are facing particularly vulnerable people. I think that's a debate that needs to happen.
All right, thank you. Erika, Dr Kate, Dr Philippa, thank you.